Good afternoon, Excellencies, heads of states and governments, President Sampaio, colleagues in the UN system, leaders in the civil society organizations and the media, and then ladies and gentlemen. Let me say so upfront, I would like to thank President Sampaio for launching this timely initiative. This global forum puts the spotlight on a strategic era. Very seldom UN agency had talked about eras. And I have to say that there is commitment for us to solve this era, and that is the uncoordinated approach of the two epidemics that are so closely related in mutually deadly ways. And you have heard from previous interventions the importance of integrating these two services. Separate services do not make sense, not for operational efficiency, not for progress in reducing morbidity and mortality, and certainly not for patients. And you have heard this from my friend Winston, who gave you his first-hand experience. Tuberculosis is the most common life-threatening disease among people living with HIV, and in particular in Africa. It is the #1 killer. Untreated, tuberculosis can kill within weeks, and also in patients receiving antiretroviral therapy. Nearly 3 million people in low and middle income countries are now receiving ARV. But we need to ask ourselves the question, where is the benefit? If a person receives these life-prolonging drugs for AIDS, yet dies very quickly from tuberculosis. If the drive, ladies and gentlemen, towards universal access for AIDS aims at reducing mortality and morbidity, then this drive simply must incorporate the tuberculosis service. And there are no technical obstacles. Let me repeat, there is no technical obstacle standing in the way of HIV-TB collaboration. Why aren't we doing it? For your information, WHO's TB and HIV departments have developed a 12-point approach for integrating activities for the two diseases, and from the grassroots levels to the national policies. And this approach must now be taken to scale if we want to see good results. Success stories tell us that we can indeed set our sights very high. And I'm referring in particular to the striking progress in countries like Kenya, Malawi, and of course Rwanda. And you have heard from the First Lady from Rwanda, the measures the country has taken to make sure that the two services are integrated to max the synergy from the two services. Now, on an average, talking about the importance of testing, on average, half of the people with tuberculosis in Africa who are tested are found to be positive for HIV. But almost 80% of Africa's TB patients are still not being tested for HIV. I dare say this is a missed opportunity on a huge scale, as testing is an entry point for life-saving interventions. Other effective approaches would include intensified case finding for tuberculosis, isoniazid preventive treatment, and infection control. These, again, are underutilized. And let me remind you, it's easy to remember. Just tell your governments, tell your officials, remember the 3 I's. What are the 3 I's? Intensified case finding, isoniazid preventive treatment, and infection control. If we can really push the 3 I's, we can make a big headway. Ladies and gentlemen, we need to act with urgency, and you have heard from many speakers. Ironically, a situation that we have long taken for granted, and that is tuberculosis is a curable disease, may actually become a window of opportunity that can be closed. Earlier this year, the World Health Organization released a report indicating the multi-drug resistance TB has reached the highest levels ever recorded. Even more ominous is the emergence of the extensively drug-resistant TB, which is virtually impossible to treat. To allow this form of TB to spread would be a setback of epic proportions. Why do I say that? In effect, we are taking treatment options back to the pre-antibiotics era. Let me emphasize again. If we allowed XDR-TB to spread, we are in effect going back to the pre-antibiotic era. For those of us who have lived long enough, like myself, I look young, but I'm not young, who have seen the very difficult days when, how we treat and take care of TB patients. Surely we do not want to go back to that era. Therefore, we must urgently address the need for better tools, for better drugs, for better diagnostics through enhanced investments in research and development. A problem of this magnitude deserves something better than diagnostic tests that date back more than a century ago. And the drugs that we are using are as old as 40 years old. So clearly, the investment in R&D cannot be emphasized enough. And last but not the least, I think we also need to tackle a perennial problem, weak health systems, as alluded to by the First Lady of Rwanda. Throughout the developing world, we are seeing very weak health systems, be it due to inadequate numbers of staff at the primary care level, or it is because of weak laboratory service, or poor management of drug procurement and the supply chain, and the list go on. Here again, on this landmark occasion, I can commit WHO on two fronts. First, I can assure you that our HIV and TB programs will further strengthen their joint effort to support countries as they accelerate HIV-TB interventions. Second, we will do all we can to foster research for better diagnostics, drugs, and vaccines, and given the magnitude of the preventable suffering, nothing less is acceptable. Thank you.